Hey, good morning, everyone. Dr. Lucente here. Saturday morning. I'm live from the car on our way up to Connecticut to see Sam Soto swim and wishing her luck. First meet today for Southern Connecticut. So today's topic is going to be on testosterone replacement therapy in both male and female. I'm going to review. And hello, Bill, Deb, Liz, Tony, Kimberly. Nice to see you all. Thank you. Happy Saturday. So, okay, testosterone replacement. I'm going to start getting into it now. What is testosterone? So, testosterone is a hormone. It's produced by both males and females. Now, testosterone is vital for life. It's produced by your testes and adrenals in men, and it's produced by your adrenal glands in women. So it's very important to have adrenal health when we're talking about testosterone replacement therapy. We're going to get into that a little bit later. So what is the function of testosterone? Okay, so testosterone responsible for new blood cells. I don't know if this is coming in backwards with you because I'm from the phone. But new blood cells, strong muscles and bones, libido, and brain health. So most people, when they think of testosterone, they just think that it's a bodybuilding drug or something that you use when you go to the gym. That's not true. Testosterone is really important as you get older to support your bone health and bone strength, muscle health, for keeping your metabolism fast, and it's also responsible for red blood cell production. And we know that red blood cells carry oxygen in your body. Red blood cells tend to decrease and diminish as your testosterone levels drop. So testosterone levels dropping can lead to maybe a mild anemia, but more so a decrease in capacity to carry oxygen to your muscles and other tissues. So that's why testosterone is really important to have in your body. So to give you a little background, testosterone is produced, actually made from cholesterol. And so that's one of the functions of cholesterol, is it actually is broken down to different steps to make testosterone, DHEA, which is your adrenal hormone that I'm going to touch on a little bit. And so cholesterol does have an important function in your body. It's not just clogging your arteries, and it's such a bad thing. So cholesterol is also vital to producing sex hormones, which is why when we see female athletes, especially younger female athletes that have very low body fat and very low cholesterol, they don't get their menstrual cycle. And the reason for that is because they're not able to make estrogen and progesterone because of a lack of cholesterol. So that being said, we know that in men, most of the testosterone production is from the testes, and a small amount is also produced by the adrenals. So that's important because I see so many men that go for testosterone replacement therapy or blood testing, and they don't get their adrenals tested. So again, I'm going to touch on that in a little while, but it's important that if you're going to get tested, to also have your adrenal glands tested as well. And there's a couple of simple tests that you can get to test to see if your adrenals are producing testosterone adequately. So again, in men, testosterone is triggered by a release of releasing hormone in your pituitary gland. So as I mentioned in other talks, your pituitary gland is the master gland in the body, and it kind of regulates your production like a thermostat. So if your body has too little testosterone, your pituitary will kick in and send a signal to the testes to make more testosterone. If there's too much testosterone, your body will stop producing it on its own. And that's why when you have guys that take testosterone replacement therapy or take anabolic steroids, there's too much testosterone in the system and their body stops making it. So the balance of testosterone is very important for having the most physiologic effects. So how do I know if I have high Janus Sheila, Eric, hey, nice to see you, buddy. Hi, Alice, Lauren. Wow, we got a lot of people on here this morning. Denise, very nice to have you all. So, how and why should you get testosterone checked? So, once you turn 35, maybe even 30, testosterone levels, like growth hormone, start to diminish. And in each decade, the levels get lower and lower. Now, what men and women will both notice is fatigue, loss of sex drive. Those are common symptoms, especially fatigue during the middle of the day is when testosterone seems to be the lowest. So natural testosterone production is highest in the morning and in the evening. So you'll notice that you're not feeling well. You get this dreary kind of tired feeling like 3, 4 o'clock midday. Your energy levels are not there. You may notice, both sexes may notice decreased strength in the gym, or decreased endurance, decreased exercise tolerance. Again, low libido. Men could have erectile dysfunction. So these are the symptoms that you're looking for. In my practice, I was routinely screening all men over 40, at least to get a baseline. So if when they were 50 and they were feeling well when they were 40, I could know what their testosterone level was when they were feeling well. And if, later down the road they're having symptoms and I retest them, I can have a baseline to see where their levels should have been at when they were feeling well. Hey Mike, how are you? Amanda? So it's important for men and women to get their testosterone levels checked. So women should check it right around the time of perimenopause, which is when adrenal stress is at its highest. So, and your adrenal function will decrease. And so, again, women, the biggest thing with women would be not only hot flashes, which is also a function of not just only estrogen, but also a deficiency in testosterone. And I've actually seen women who have started testosterone replacement therapy, and it's completely eradicated their hot flashes. So again, it's all these hormones are working together in your body, and so when one's down, all the others are going to suffer. So these are the symptoms. So you go to your doctor, you have these symptoms, he's running a whole battery of tests, and what tests do you want to get? So I have, let me see if my card. So here are some of the tests. You want to get I don't know if this is backwards, but free and total testosterone. So the reason that that's important is that testosterone is, once it's in the bloodstream, hey G, how are you? It's heavily bound to two proteins. One is albumin, and the other is sex hormone binding globulin. So these two proteins bind testosterone and actually prevent it from getting to the receptor. Now, where are the testosterone receptors? Well, they're all over the body, but mostly in your muscle, brain, heart, and so that's where you're preventing the actual testosterone from getting to its target. So really the only important number is the amount of free circulating testosterone that's going to get to the receptor and cause the physiologic effect. A lot of times, guys would come up to me and say, hey, my testosterone's 500, and my first question is, well, what's your free testosterone? And they're like, well, I'm not sure. Well, if you're going to go for therapy, then you really need to know your free testosterone. And then the second question I ask is, what kind of symptoms are you having? Because if you're not having any symptoms and your testosterone's 500, then there's no reason to treat that. Oh, Val has. I'm going to answer this question because it's going back to a point I made earlier. If I control my cholesterol aggressively with meds, can that add to contribute to lower testosterone? That's an awesome question. It's not proven, but based on the research, it is likely. If you bring your cholesterol down way under like 150 total cholesterol, it is possible that you can have cause a testosterone deficiency. So it's something that you should definitely get checked out. Other tests that you should get done besides free and total testosterone. Now that's in men and women. sex hormone binding globulin, which is SHBG, which will also give you an idea of the free circulating testosterone. DHEAS, which is DHEA is a adrenal hormone, and now that's really important in women, but it's also important in men to see how your adrenals are functioning. So now I'm going to touch on the adrenals just a little bit. Your adrenal glands are located above your kidneys, and they have two really important functions, right? They produce two very different hormones. One is DHEA, and one is cortisol. Well, cortisol is a hormone that's produced under stress. So when your body's in a stressful state, whether it's because of disease, mental stress, your body produces more cortisol. And what does cortisol do? It makes you fat. It literally makes you fat. It makes you deposit fat. Hey, Sal and Angela, thanks for joining. So you're depositing this fat on your body. People get like a moon face. If they have really high cortisol levels, they'll deposit fat in their face. Now, DHEA is the completely opposite. DHEA is produced in times of health. It promotes muscle mass. It decreases body fat. It increases energy and libido. So a good way of testing your adrenal function, because cortisol fluctuates so much, is to measure something called DHEA. And you want to measure DHEA, if you can see the S, DHEA sulfate. So you want to tell your doctor to order DHEA sulfate, and that'll give you an accurate a level of how much DHEA is circulating in your bloodstream. So again, if it's low in women, one thing that we can do is replace DHEA, and that in turn will convert to testosterone. And then if you're a male, the other thing you want to get is a free and total PSA, and that should be done baseline with testosterone therapy. And I'm going to tell you why that's important, because this could be a really important diagnostic tool for detecting early prostate cancer, and I've used it all the time in my practice. So let me talk about the levels again. So a normal level in a man is anywhere from 270 to 1,070. So I don't know about you, but to me that sounds like a huge range. And the problem with the range is that it just describes testosterone levels from basically an 18-year-old to I think it's a 70-year-old that it was calculated. So that's going to be a very broad range, right? Your 18-year-old's probably going to have the 1,000 testosterone level, and the 70-year-old is probably going to be at the 270. Now, the goal of testosterone replacement therapy is not to bring you and make you superhuman. It's to bring you back to a range where you are feeling healthy. Now, for most men, that level, and I'm going to talk about total testosterone right now, but it's a level of 500 to 700 is a great level to be at. Some men may feel better at 800, some men may feel better at 400, and that's why you have to be monitored. Now, in your free testosterone in a man, it's about 200 to 700. So again, you want to be like to the mid to high range. Now, in women, just to show you how little testosterone women have, but how important and how potent it is. Women, a normal testosterone level is only 15 to 70, and a free testosterone of 0.6 to 1.08, so like 100 times less than a man. However, it's important to keep that level, again, in the high to normal range, right? So that the upper level, you want to stay between the middle of normal and the upper level of normal. And 99% of the time, you're going to be feeling better, and you're going to know that you don't have a deficiency. So that's really important to discuss this with your doctor. Describe your symptoms. Now, again, no doctor is ever trained to treat labs, right? And we see it done, however, we see it done all the time. If somebody has a testosterone level of 500, and that's right in the middle, but they have symptoms of low libido, erectile dysfunction, fatigue, loss of body hair, all of these symptoms, you know what? Then they might have been functioning at 800 or 900, a few years ago, and now they dropped drastically. And that's why it's important to get that baseline when you're younger, to know when you're feeling well what your testosterone level is. And the same goes for women. If they're having symptoms of low libido, maybe they've already replaced estrogen and progesterone, or they're taking some supplements, their hot flashes are gone, but they still have no libido. Well, testosterone, very important. But also in women, very important that during the time of menopause, your risk for osteoporosis really skyrockets. And we always used to thought that it was the drop in estrogen and progesterone, but what this latest studies are showing is that it's actually the drop in testosterone in women that is causing the osteoporosis, or at least contributing to it. So very important for women to get their testosterone levels checked if they're perimenopausal. Let's talk about therapy now. So how, now you've been diagnosed with testosterone deficiency. What are your treatment options? Well, there are a lot of options. I'm going to start with men. Actually, let me start with women. Women, it's pretty straightforward. First thing I would try in a woman is replacing DHEA, because DHEA again is a precursor of testosterone, and by replacing DHEA, you can indirectly increase testosterone. Now, a typical dose of a male dose of DHEA is 50 to 100 milligrams, and that's the dose that you'll typically see on the shelves. But for a woman, a starting dose of DHEA is going to be around 5 milligrams, and you can easily find that dose online, and you may go up as high as 10 milligrams. And then you could monitor the levels. You could measure DHEA levels, and then you could measure testosterone levels to see if your therapy is working. So that's one option. Another option is women can get either a testosterone pellet, which is a surgical procedure, a small surgical procedure that is inserted under the skin and releases testosterone in small amounts over a 4-month period. Hey Pat, nice to see you. So that's one thing. And then there's injections that they can get, again, in a tiny, tiny dose, which is typically given every 2 weeks. Or you can get a compounded natural testosterone cream from a compounding pharmacy, and there are some locally in Staten Island. Delco Drugs is one, and there are others on the internet you could find. But so you can go to a compounding pharmacy and get a cream made in a dose that's appropriate for a woman. So those are your options. And again, you want to monitor your free and total testosterone levels, your DHEA levels, probably about a month into therapy, and then every 3 months thereafter. And once you're on it for about a year, you could probably monitor it every 6 months. So really not that important once you get to good levels, unless your symptoms change, to really have to monitor that closely. Hey Danielle, thanks for joining me. Now, men. So men have a little bit more options. They have over-the-counter supplements. There are a lot of precursors out there. One of my favorites that I've actually seen work is something called Tribulus Testaris, and that's over-the-counter. It actually helps the pituitary release the releasing hormone for testosterone. So that's a good one. And then there's androstenedione, which is another precursor to testosterone. Again, you could try these. I'm not a big fan. They may work. They're good typically for younger people, 35 to 45, that are just maybe starting to drop. The second option is HCG. HCG is, many of you may know this already, is the actual pregnancy hormone. It's human chorionic gonadotropin, and what that does, it's a good treatment option in men who are still wanting to have children, because HCG actually will both increase testosterone and sperm production, whereas if you're on testosterone injection, it's going to lower sperm production because it's inhibiting the pituitary from producing both testosterone and sperm. So now if you're 50 years old and you have no worry about having children, you could take the injection. If you're 35 years old or 40 years old and you're still thinking about having children, the best option would be HCG injections, and that's usually monitored by your doctor or fertility doctor, and that will boost both testosterone and sperm count. And also, so if you're coming off of testosterone, you were on injection and you're thinking about having a child, you can come off the testosterone, transition to HCG. That's a good option. There are pills like Clomid, which are used mostly in the bodybuilding world. Not a big fan. They have side effects. I think the HCG is the best option. It can be easily monitored by a doctor, and it's it's very efficacious. The other option now, you have testosterone injections. They can be given as frequently as every week or every 2 weeks. Some testosterone injections are monthly. Again, it's a needle. It's not really painful, but it's a needle into the muscle, or sometimes under the skin. It is safe. It's easily monitored, but the levels can fluctuate, and it may take some time to get you to the right levels. It may take a month or two to kind of regulate, or even longer, the right dose that you need to be on. Then there's testosterone gels, which the two most popular would be Androgel and Testim. And these are, hey Nelson and Mike and Edwin, nice to see you on here. So those gels are rubbed in the skin, usually in thinner skin areas. If you have children, young children around, you have to be careful of transference to your child or your wife. So that's a factor. They can be expensive if your insurance doesn't cover it. Injections are much more cost effective. And then you can get a natural testosterone cream compounded from a pharmacy. If your insurance doesn't cover a gel, the cream may be a cheaper option, because typically that's something that could be produced a little bit less expensive from a compounding pharmacy. All of them are effective. Some work better for others. Some people love the gel, hate the injection, and vice versa. It's up to your doctor that's monitoring you for you to communicate your symptoms, and that's the most important thing. Again, you want to see remediation of your symptoms. So yes, you're going to see your levels are improved, but if your symptoms are improving, then either we're looking for something else, or you just need to adjust the dose. So that's really important. And then lastly, I just wanted to go over a couple of misconceptions about testosterone, right? One, testosterone does not cause prostate cancer. In fact, the latest studies, and one of them is from a doctor out of Harvard that I've been following for years. His name is Abraham Morgentaler, and he's kind of the guru of testosterone replacement in this country, especially over the last 10 years. And what he was finding is that if you think about it like this, young men with high testosterone levels never ever get prostate cancer. Never, right? Who gets prostate cancer? Older men with no testosterone in their body. The reason that they thought that testosterone caused prostate cancer is because when we castrate men, or whether it's chemically or physically, that have prostate cancer, the cancer stops growing. Well, that's because all prostate cells flourish in the presence of testosterone. So if you have prostate cancer and you take testosterone, yes, it will grow faster. But I use that as a diagnostic tool I've caught at least 10 people that never knew that they had prostate cancer, and the only reason they knew that they have it because they started testosterone replacement therapy. And I'll tell you how that was done. I did a baseline PSA. I started them on testosterone, and I retested them in a month. After that 1 month, I saw their PSA jump up more than 0.5, and which triggered to me is that there's something going on in their prostate, because your PSA should not elevate much after initiating testosterone replacement therapy. And if you see it go up, that's a trigger to go get your prostate checked by your doctor. So now, if you take testosterone therapy and you don't have prostate cancer and your PSA stays great, you're going to see over the years your PSA is going to stay the same or go down. So it actually keeps your prostate healthy, and the theory is that it actually prevents you from getting prostate cancer later on in life. So that's a big misconception that's been disproven and is more now widely accepted in the medical practice. Women, if I take testosterone, I'm going to get big and bulky. Not true. If you're taking testosterone replacement, we're only replacing it to a level that you've already had in your body when you were feeling good. We're not replacing you to a male level. We're not replacing you to a level beyond what was normal for you. So you are not going to get big and bulky if you're on testosterone. On the contrary, you're probably going to get smaller because your metabolism is going to speed up and you're going to lose body fat, right? I'm scared of testosterone because of all the things that I've read about it and I've heard about it. Well, it's one of the healthiest things you can put in your body. And the way I think about it, and I just had a conversation yesterday about this, you're replacing a hormone that was normally in your body, that was in your body since you were 18 or since you went through puberty. And we're replacing it to keep you healthy, improving muscle mass, decreasing body fat. Isn't that better than surgically removing somebody's stomach, or, you know, implanting breasts and all of these, you know, breasts and butt implants and all these things that are acceptable to look better and feel better, but replacing a hormone that's supposed to be in your body was thought of for years as being like taboo. But now it's become mainstream. I'm very happy about that. And so it's a safe therapy. It could really be life-changing. Down the road, I'm going to talk about other great hormone therapies. I did one on thyroid. Eventually, we'll do one on growth hormone. We'll do one on adrenals. And I think that hormone replacement therapy is a great way to keep your body young and fresh, to prevent disease, to keep you feeling your best, to keep you looking your best. And you need to get to a doctor that's well-versed in this. If you have any questions, you could always consult with me. I do have a consulting practice. I work with over the phone or through the internet. I'd be happy to work with you and your doctor and help you get through your therapy and figure out what's best for you. I do a blood work analysis. I also am running a special this week. You can look at that on my Facebook page. And I'd like to announce that on October 11th, I will be appearing in Staten Island at Studio B on Richmond Road. I'll be discussing low carbohydrate diets. It'll be a great event. It's a great place to work out. The owners are fantastic. They're good friends of mine. And it's going to be real fun. We're going to do a big question and answer session. We're going to talk about paleo. We're going to talk about keto. We're going to talk about intermittent fasting. And hopefully I'll get to see a lot of my old friends. And I'm looking forward to that. So everybody enjoy your Saturday. I hope you all have a healthy and happy weekend. And I'll see you next Saturday.